All right. Well, good morning, everyone. Thank you very much for being on this call. Everyone is wide-eyed and bushy-tailed, as they say, and very, very grateful to have you all on the call live in person or virtually in person, or however you want to look at that. But thank you for being here. As we normally start, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission, and thank you for all you do for your members and obviously your prospects as well. It is wrapping up the end of March, wrapping up the end of OEP. We've got a few days left to close the month. So this is the time of the month where we need to go back and recap on what you've done over the last 90 days and ensure that all of your members have been enrolled and making sure that they're closing up all of your apps by the end of this week. Because believe it or not, April 1st is next week already, and we are out of Q1. And so we're going to talk about Q2 and some of the initiatives that we have going on throughout the summertime. But as we normally start, we always have to keep one foot in the classroom and the other one in the field at all times. So I'm going to share my screen to let you know the good news about all the training sessions that we've got going on for this week. So later today, we've got Mr. Ricardo Cabello, who is going to join us from Ultimate Health Plan. Sorry. I see UHP in the bottom there, and that was a really close call there. But Ultimate Health Plans is going to he's going to share us all the good news on what's going on with Ultimate, because they've got some phenomenal plans here in Florida, and they've done some expansion. So he's going to give us the good news on that in just a few minutes. Later today, United Healthcare is doing their VA and TRICARE training at 11 o'clock. So if you need to get boned up on VA and TRICARE, you can do that. That's today at 11 o'clock. Later today, also, you've got Devoted doing their Building Strong Relationships with Providers. This is the backbone of what we do here at Health Plan Markets. So, if you're new to the game, this is a great training to learn how to work with providers. So check that out at 3 o'clock. Moving over to tomorrow, the 26th, same thing happening with Devoted. They've got another session at 11. United Healthcare is doing their LIS training at noon tomorrow. So if you need to know about LIS, Low Income Subsidy Program, great training for that at noon tomorrow. And let me just say, guys, we're getting ready to go into lock-in here. And if you don't know how to maneuver extra help programs at this time, you are not going to make many sales during the summertime. You have to know how to do LIS. You have to know how to do Medicaid. And so these are great trainings. You have to be there to learn how to do it. And if you don't know how to do it, if you don't know how to maneuver these programs, you're going to lose sales. Many opportunities that are out there to get people enrolled that need extra help. Also on Tuesday, tomorrow, you've got Humana doing another veteran training at 3 o'clock. Check that out. Wednesday, 9:30, our very own Al Clancy doing a virtual coffee and chat session. We're not getting a lot of attendance here, but I will tell you that the agents that have attended these classes with Al have been able to spend an hour and a half of personal coaching. And I am so excited to hear some of the success stories that for those people that are actually showing up and bending Al's ear on Wednesdays. The man is a wealth of knowledge and can really help you put your career on track. So if you're not taking advantage of this weekly 1 hour open door with Al Clancy, shame, I know your name. This is really going to help you speed up the game. So 9:30 on Wednesday. Also on Wednesday, Cigna's got their open virtual office hours at 11 o'clock. But we also have one of our very first sessions for our contracting team. They're doing an open door question and answer for contracting. Again, this is, I think, the second version that we're doing here. But the girls have gotten together on Wednesdays at 11. If you need help with contracting, if you're lost, if you just don't know what's going on, if you need an update, you've got a Q&A session on Wednesdays at 11, open door. Anyone is welcome. Also on Wednesday, Humana's doing another retention training. How are we keeping all those chickens in the coop? All that hard work that you did during AEP and OEP, how are you keeping your clients happy? How are you retaining them? Humana's got a training at 11:30 on Wednesday. There's another one for devoted, building the strong relationships with providers. So there's 3 different options for you. Another one at 12 for Wednesday. Also on Wednesday, those of you in the Orlando market, Advent Health has now expanded into the provider market space. PCP offices are now opening, called the Advent Well 65 Plus. And the first iterations that we've seen around Orlando, there's about 3 offices. There looks like they're opening up a 4th one here in Stanford, but they may be coming to an area near you. So if you see these open houses, this is an opportunity for you to go in, shake hands, drop business cards, and make a relationship with a brand new provider's office that is looking to grow. So there you go. Anyone in the Orlando market, mosey on up to Sanford at 1 o'clock on Wednesday, meet a new doctor, check out the facilities, and get acquainted in what Advent Health is doing for their 65 plus, for those of you that are focusing on Medicare. Moving over to Thursday, we've got our monthly advisor meeting at 10 o'clock. So those of you in the Florida market or within driving distance are more than welcome to come on over. We're doing a quick training and a meeting from 10 to, I think it's going to go to 12. We're going to get you a nice breakfast and snacks and all that stuff. But we've got, we're hosting it at the Guidewell Center. And we're going to specifically talk about grassroots marketing at this particular training. So if you need to learn more about that, come on down Thursday, the 28th. Also on the 28th, Humana is doing their 10 steps to sales success. That's at 1 o'clock on Thursday. United Healthcare is doing their grassroots marketing at 1 o'clock on Thursday. So if you can't make it to the physical meeting in Orlando, that's fine. You can jump on that UHC training and they'll get you set up. Also, last training on Thursday, Humana's Med Sup Madness. If you're new to med supplements or you want to get familiar with Medicare supplements, this is a great training for you to jump on. Friday, we've got What About HPM Shop? That is our quote and enroll tool, all set there. Again, this is how we do our Medicare Advantage enrollments. So if you need some TLC, that's at 9 o'clock with Mr. Tom Ryan, and he'll get you set up and rolling on that. And then the last training for the week is United Healthcare Find and Engage Consumers. Again, marketing. We're going to talk a little bit about that this morning. What can we be doing to market ourselves, getting out in the community to ensure that we're doing what we need to be doing to grow our book of business. So with that, that is the training for the week. Remember, we've got to keep one foot in the classroom and the other one in the field at all times, just the name of the game, okay? So we were talking about community engagement, and the biggest part right now for agents that feel like they're not growing fast enough, maybe you've hit a plateau, maybe you've hit an area or a rut where you're not seeing the success that you need to be seeing, okay? A lot of these times when you see that, you need to go back to basics, okay? Back to basics means, how am I getting out there? How am I making sure that people know my name? How are they finding me, okay? Am I easy to access? Where would I want to set up events so I have traffic? And I got some pictures over the weekend. So congratulations to Katrina, who's been doing 2-3 events a week at this point right now, brand new agent. She got a lead in a possible sale for spending an afternoon on a Saturday. Okay. So these are things that you need to be doing, and we're here to support you in any way we can. We can help you with tents, tables, tablecloths, giveaways, filing the event, helping you find events, all that stuff, but we can't do the events for you. We can't motivate you to do it. You got to be able to go out there and do it. So as a recap, if you want a sale, you got to look at the funnel inverted, okay? The sale is at the end of the part, and really the journey starts there for your client, but I'm not going to go through that. To get a sale, you need appointments. To get appointments, you need prospects. To get prospects, you need leads. And to get leads, you need traffic. Traffic is at the top of the funnel. Where is your traffic? You know, do you have a place that you can go? Are you at health fairs? Are there seniors walking by? If you're doing ACA, are you somewhere where there's heavy traffic for families? You know, where are you? If you're just sitting at home and not doing activity, they're not going to call you. They're not going to see you. They're not going to know you. So it's really about activity at this point. You have to get out there and you have to get people to know who you are. Okay. So event community engagement is big. Those of you in the Central Florida market, we have a brand new secret weapon with Mr. Chan T, who's been out there every day helping agents set up their events and making sure that they've got the supplies and the marketing materials needed to make sure that their events are successful. So thank you to Chan for all of his help and making sure that the agents get what they need. So events, activities, 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 okay? I'm seeing names on this call today that I have not seen events from. Some of them I haven't seen events from ever. And that's kind of scary. How are you going to generate leads if you're not out there? Okay. Some of you have other lead sources. I get that, and that works for you. But community engagement is really big, and it's going to be a big part of success for agents during the summertime because open enrollment starts now. Open enrollment starts now. You cannot wait until October 1st and expect to have leads jammed in your pipeline. You need to get out there and you need to make sure that you're meeting people and collecting consented contacts now, not on September 30th, not on October 14th. Now, you are going to have a very bad AEP if you do not start activity now. It's the most important thing that I can leave you with today. Last quick announcement before I turn it over to Ricardo, who's going to give us the good news on Ultimate. We are happy to announce one of the goals that we had for 2024 has been achieved. We are now moving to a weekly commission cycle. A weekly commission cycle. Yes, I know Rosie's excited. So for those of you that are receiving any type of commission via HPM, some carriers like ACA do require us to pay on behalf of the agent or on behalf of the carrier to the agent. And then those agency partners that are out there, we are now moving to a weekly commission cycle. Starting tomorrow is the first day. Tuesday, Wednesday, you'll get your statement. And then Friday, direct deposit. Every week, we're going to be launching a brand new commission schedule. So you'll have that. And so you can kind of understand, which carriers are going to get paid on which day. So weekly, moving forward, very, very excited about it. A lot of work was put in to make this happen, and very excited. Just one last quick note: you'll get an email from us and from our new pay company called Gusto, and that's the company that's going to help us get this done weekly. So just keep an eye on your emails. If you get something from Gusto, Gusto, you know that that's from us, and we're going to get your payment all set up and paid weekly. So I knew you guys would be excited about that. Cash more often, right? All right. I am happy to introduce our friends from Ultimate Health Plans. I have Ricardo Cabello and Lexi Olson on the call today, and they are going to give you the great news about Ultimate and what's been going on their side of the fence. So, Ricardo, take it away.
Hello and good morning, everyone. Good morning again, Justin. Thank you so much for giving us the opportunity to get in front of your team members. And I'm also here with Lexi Olson, who is our broker manager. Lexi handles 16 different counties where we have different plans. And this is going to be the second year for Osceola, Orange, Seminole, and also Polk County. I do handle Osceola, Orange, and Seminole. And once again, I'm also here with Lexi Olson. This is probably going to be one of the fastest trainings that you have ever seen, but I can do it. Believe me, what United Healthcare can do in 2 hours, I can do it in 15 minutes.
Love it.
So I put together this document. It's I believe you can see it right on the White Ultimate Health Plan 2024, correct? Thank you.
Good to go.
So some of the things that we have to offer is, first of all, we make it very simple. We have a core plan, we have chronic plans, and we have dual plans, one for partial and one for full Medicaid. That being said, we also we're not making up new plans that at the end of the year we're canceling, and then you have to move your book of business around. We make it simple for you, for the consumers, and we have a great balance with the providers, because nowadays, with all the different cuts, with the different providers, the health plan has to be very responsible, and it has to have a balance between what they offer to the consumers, to the agents, and to the providers. And we do that extremely well. So our plans for 2024 Medicare Advantage plans are extremely competitive. One example is our Premier Plan 046. That's a core plan, which offers a RB buy down of $160 a month, and it's at the same time keeping all the copayments low and giving someone a over-the-counter benefit, like we're not even giving you the Part B. So I call this plan, the core plan, the Premier Plan, a hybrid. RB reimbursement or buy down, and also the fact that we have good benefits and low copay. So when someone goes to the specialist, the emergency room is only $75. We have plans, chronic plans, where you only have a $50 copayment for the emergency. When someone has a chronic condition, let's say asthma or a pulmonary condition, you really want a plan that when they go to the emergency room, because it's going to be very likely that they do, that they only pay $75 or even $50 for the emergency room. The ambulance, you probably will not find a copayment lower on any of our in our plans outside of Ultimate Health plans, a lower copayment. So, and we still cover the $50 over the counter, where they can go to different stores. And I'm going to tell you more about that in just a second. So most carriers, they increase the copayment when offering Part B buy down. I have been with 5 major corporations. I have been with 2 different FMOs, both public companies and nationwide. And so I know the competition very well, as of course, our plan. So the Ultimate Health Plan formulary, this is one of the biggest news for you when you're sitting in front of someone, and then you go and try to look for medications that are non-formulary, medications that are on level 3. For example, we have Eliquis and Xarelto are tier 2 for us, and you can get a 90-day supply and only pay $50. So at the end of the year, you're really paying $200 for Eliquis, a medication that costs between $500 and $600. And so our formulary for the providers, as well as for you and the consumers, is one of the best that I have ever seen. And we have everything color coordinated. The blue formularies are for the core plan, the green formularies are for the chronic, and the orange are for the duals. And we do the same with the benefits to make it very easy. I have never seen so much common sense when it comes to materials, benefits, the way the plan works, etc. So the Ultimate Health plans have the best, some of the most complete and best formularies that I have seen before, covering prescriptions on tier 1 and tier 5 during the coverage gap. So some of these new medications for diabetes, where someone is only paying $10 a month, even when they go into the donut hole, now they still pay $10 a month, but they can get a 90-day supply and pay only $20 for 3 months. Our chronic special needs plan formulary covers prescriptions that other plans either don't have on the formulary, or they have it on tier 3 when we have it on tier 5. Also, our tier 5 offers a $10 copayment, as I mentioned before, and we use Optum Rx mail delivery, and you pay 2 copayments for 90 days. The ultimate benefit card can be used at stores like Publix, it's everywhere, Walmart, Winn-Dixie, Walgreens, CVS, Dollar General, and some of the Save a Lot food stores. This is a great benefit because your clients are not ordering from a small little catalog where half of the items are not available and the other half of the items are brand names that I'm afraid to take on. Ultimate benefit card can be used at the stores that I mentioned before, but you can also order online with Walmart.com. And because our chronic plans offer a amount for healthy food, utilities, or over the counter, you can also order food from Walmart.com. And if it's $35 or more, you don't have to pay for the shipping on that, which is a great benefit. Not to mention that when you get your over the counter items, you have 1,000 items to choose from on Walmart.com. So your ultimate benefit card is reloaded every single month. And some of the awards that when you go and do physical exams and all of the things that you do, that money is also put into your ultimate benefit card. The ultimate benefit card covers over-the-counter items and healthy food items for all of the different plans. Only our chronic plans and dual plans have healthy. Only our chronic plans will allow you to use the card to pay for utilities, natural gas, electric, and water bills. So the over-the-counter items can also be ordered on Walmart.com. The annual $500 flex card is only for duals, and for that reason, and for the reason that we have no co-payments on the partial dual plans, it makes our partial plan extremely competitive because now you have healthy food. You can go to all the different stores. You have over the counter, and you have an additional $500 for dental, hearing, or vision. And for these parcels, it is extremely competitive. I'm not going to tell you that the full dual plan is going to blow everybody out of the water. However, the partial plan from Ultimate is extremely competitive, the core plan and the chronic plan. If you encounter someone that you're going to help is not happy with Simply or Freedom, what else are you going to offer them? Ultimate health plans. Because when a plan offers you only $85 for healthy food and utilities, and we offer you $125 a month, that's a big deal because the over-the-counter separated, how many Band-Aids can you get in every single month? And how many of these generic items are you going to use? It's money that is being wasted. So we're very smart on how we put together the benefits. Again, a balance between the providers, the consumers, and the agents, because we want to put a very competitive plan in your hands. So this $500 flex card and the fact that they have $100 for healthy food, the parcel dual, and the fact that they have another $125 for over the counter, and they can order from Walmart. The fact that our transportation goes way beyond the primary care physician's office, and I'm going to show you that in just a second. It makes our plans very competitive, especially the dual parcel plan. There are no co-insurance, co-payments, or anything on preventive. Every plan does that, but a plan overview is one of the best materials I've seen. It makes it so easy for you to explain every single thing about the donut hole, the different part A and B and C and D, and how the ID card is going to look like with every single phone number that they need on the back, every single service with their website, phone numbers. When you leave this with someone, it's like a Bible. They will not call you with so many questions because you have a material that really makes sense and is really something that they can use. And I show you in a little bit a sample of that. The member ID again has every single phone number that the members need, and we cover everyone a minimum of $50,000 worldwide emergency coverage. The emergency copayment will not be 50 or 75; it's $100, but still great benefit because $50,000 go a long way in Dominican Republic. In a $100 copayment, it will be almost nothing compared to an emergency cost. If you get X-rays, lab services, and nuclear tests, and outside of a hospital location, you pay $0 to $25, $25 for an MRI. And again, a plan like the chronic plan that is reimbursing $164 for your Part B, and is giving you $125 for a flex card, and on top of that is you go to get an MRI and you only pay $25. It's a big deal for a lot of individuals. And like Justin was saying, we're helping people, and it's a beautiful thing. I believe that with Ultimate Health Plans, you can help a lot more people. All of our chronic plans have a Part B buy down, and I'm going to show you that in just a second. And the chronic plans have up to $125 per month on the OTC, healthy food, and utilities. We also have a dual special needs plan, both for full and partial, but our partial plan is almost exactly the same. No copayments, $500 maximum out of pocket, etc. I'm going to show you that in just a second. Also, the chronic plans have a maximum out of pocket in your area, in Osceola, Orange, and Seminole, only $1,900. And not only has amazing competitive benefits, but the maximum out of pocket is also a big deal for those individuals who have chronic conditions and they end up in the hospital and need a lot more than anybody else. Of course, we do offer silver sneakers. And I put this one on green because this one is huge. We protect the agent of record. We're protecting your business. We're not making up different plans every single year that you have to go chasing your own business just to save your renewals. And excuse me. And we do that. You put someone on the core plan, they qualify down the road for the diabetes plan. Anybody else goes and change them, you're still the agent of record. And that's what you do this for the long-term opportunity that this business offers you. So if, let me just go back here really quick. This is the core plan where it's good for Orange, Osceola, and Seminole. It's a $2,900 maximum out of pocket. We return $160 for Part B. The hospital, as you can see, even though we return that much for Part B, the hospital copayment is extremely low, as well as the specialist copayment. The ambulance is only $175, the emergency room $75, the urgent care is $10. As you can see, all of the other benefits. Let me go here. Just to show you, again, everything that is premier is in blue, everything that is chronic is in green, everything that is in orange is a dual. 1 second, please. And so we have a $200 for the eyeglasses on the core plan and a $50 for over-the-counter. There is a little bit of transportation on that plan, but the transportation takes you to so many different places, like the PCP specialist lab, imaging centers, pharmacies, dialysis centers, gyms, banks, food pantries, grocery store, post office, etc., including the VA facilities, and that's a big deal. So we use Safe Ride, and they need to do it 72 hours in advance. On the chronic plan, the 050 for Orange, or Osceola, and Seminole, it's the same plan again, maximum out of pocket. You will not find one lower than that for a chronic plan. We reduce the Part B premium by $164.90. And as you can see, the copayments at the hospital, the emergency room, the ambulance is $150. It's extremely competitive. And I'm almost done, Justin. This plan will cover $300 for the eyeglasses and $125 for the healthy food, over-the-counter, and utilities. And it also have a little more. It has a little bit of transportation. Now, our 023 plan is for the COPD and covers all of those counties. And again, extremely competitive when you have someone on either Simply and Absolute, Simply, and Freedom. These are some of the examples of the medications that we have on our formulary and tier 5 and tier 1. This is a big deal, again, for doctors that are trying to prescribe what their patients really need, and for you who are looking for on our website the different prescriptions and whether or not it's formulary. You will find that most of the time your medication search is going to come up with formulary, and it's going to come up with no prior authorization and no step therapy. I'd like to have another time where I can show you these tools. Unfortunately, today we do not have the time, as you can see. This is just an example for our ID card that makes all the sense in the world. Why is somebody calling you because they need transportation and the only number that they have on their ID card is member services? Doesn't make sense. The over-the-counter, again, you can go to all these different places. These are the dual plans where you can see that it's basically the exactly same plan for partial, the 036, and for dual, the 035, full dual. And again, we have the healthy food, the over-the-counter, and the flex card on here. Addition, we offer dental. We have very good benefits. The benefits overview will give you that. You should have access to those. You can order those as well. I can bring some to your offices. My phone number is on the chat. My email is on the chat. I'm only a phone call away. If you send me a text and I don't answer, please call me. I will definitely, I'm someone that when my phone rings, even if it's a phone call that looks like a scam, I will answer because it may be one of you calling me. And as I was telling you, part of the benefits overview, one of the best materials I have ever seen, has every single one of the services that we use. When they have a website, we put the website on there, and we have every single phone number. So your client can go back to this page 32 or any other page within the benefits overview, and boom, you don't have to get a phone call. You have a happy member on plans that will be there next year, and that you don't have to chase your own book of business. Also, the fact that Connector has a way for you to see Ultimate. And some of you don't know that. Please go back to Lina Salazar, to your manager, and see how you can look at Sergio or whoever within your organization. I'm not sure if Cindy will know that, but anyway, you have a way to see it. All you have to do is go to Sunfire to go ahead and enroll someone. Lexi, would you like to add anything else?
Well, on that note, actually, thank you, Ricardo. I mean, I know we were drinking out of a fire hose, and today is, to make sure that everyone understands that Ultimate is a player in this market. And, one of the biggest complications, as you mentioned, is we're not able to do an Ultimate enrollment on our software system with HPM Shop. But I am going to, let me see if I can take over the screen, and I'll go ahead and show you guys where you can do that. So when you're in an Ultimate territory, like Ricardo was saying, here's Orange County here in Orlando. The way to see the Ultimate plans is you can click Add Non-Licensed Plans. And when you do that, it'll add all of the plans that is showing is that you're not licensed. Or that you can't do the enrollment. So you'll scroll down to Ultimate Health Plans here on the left-hand side, and you'll see that they have the Premier plan here in Orange County as well. And there's a way to look at the duals as well. But you can do this and look at the plan details. You can also add it to compare if you're looking at another plan as well. But the actual enrollment has to be done through their Sunfire enrollment system. Again, I'm sure Ricardo's going to send us out some trainings and some dates when they're going to be doing the enrollment training. So we'll get that over to you guys. But you can reach out to us as well directly, and we'll be able to walk you through and get you guys going as far as the enrollments are concerned. So thank you for mentioning that, Ricardo. That was on my to-do list there.
Thank you.
So there's a couple questions in the chat that want to give to you. There's one from someone here. It says, will Ultimate ask for our call recordings for enrollments moving forward? And I think in general, can you talk about how you guys handle call recordings and how that's managed at Ultimate?
Yes, we do have a system that we use for all of our associates and the internal agents that it's called Crescendo, and we do have the capability to record calls in incoming calls and outgoing calls. For the agents, let's see, do we have anything additional for external agents?
So I actually know what this agent is referring to. We did have one of our audit reps reaching out to all of the brokers, and to my knowledge, we are going to see if they can either stop that, because we know that a lot of these other carriers aren't asking for, you know, like a monthly recording calls. I believe that they were just trying to get prepared for some of the, you know, if anybody came back for auditing. So I believe at this time it should come to a halt until further notice. So yeah, you guys should not have to worry about it, but you guys do have a recorded line that you guys use as well, right?
Yeah, so as a reminder, just to make sure that everyone understands, the compliance reads that you must record your sales calls with Medicare eligibles. Okay, so we recommend that you use Ring Central, which is what we've talked to you guys about for the last 18 months. Some agents have their own system, some use it, different apps and things like that. But the moral of the story is you must record your sales calls and keep them for 10 years, just like a scope of appointment. So if Ultimate comes back and says, hey, there was a compliance issue 2 years from now, we need to pull that sales call to ensure that you did it. And so that they can get the true story of what happened in that enrollment process. So, everyone is aware, everyone should be doing this. If you're having complications with call recordings, please reach out to us and we're happy to help with that. All right.
Thank you.
Yeah, absolutely. Now you got Sergio here, so bear with us here. He's got some questions for you. What Florida provider groups do you work with? Do you have specific MSOs
Yes.
or IPAs that you're working with tightly?
Yes, we're working with IMA. We're also working with AGIS and physician partners, all the Salud VIP, etc. We do have at the moment CareMax, and that's going to be terminating on June 1st, unfortunately. We're also working on finalizing Advent Health, and that's going to bring the hospitals, the specialists, and some of those wholly owned centers that you were talking about before. That's basically in final stages. And of course, we have Orlando Health and providers, and a lot of other providers like smaller providers that have 4 or 5 offices. We do have those providers as well. Kaler Moreno, Advantage Medical Group, etc.
So no lack of providers is the moral of the story there. So
And that being said, sorry,
yeah.
Justin. If you have a specialist that you want us to get on the on Ultimate, please pass that information to me, because I work so close with Pamela Torres, who I know since I was at Humana manager in Miami-Dade County for 8 years. She was part of the administration. She's our provider contracting manager, and we just sent one to her, and it was in less than 5 weeks. It was already on the books. So
Wow.
that's extremely important that you or your providers will pass us that information, because we, Pamela and Naeem and the rest of her team, we work so close together. We have a WhatsApp chat with them together. They come to my team meetings. They just part of sales, basically.
I love that. Love that. And to wrap things up, because I know and thank you for spending some extra time with us. You had posted the community events coordinator, Orlando Reyes. And for everyone that's on the call here, please jot down his phone number. Orlando's phone number is 407, excuse me, 914-8980. And I'm assuming Orlando will help you organize your events and help you support those community activities for Ultimate. Anything else we should know about that, Ricardo?
Yes, not to take anything away from Mr. T. I know you rock. Orlando Reyes had been with IMA for 12 years. Most every broker knows him, every carrier. He has so many opportunities out there. We have been able to open doors at churches that we were not able to open before. Orlando Reyes is one of the best by far. Of course, the more production that we see from an agent, the more we can justify giving you support. And I think there was another question about Hernando County.
Oh, yeah. Bud was saying that you guys have Access Healthcare in Hernando County, so he was just pointing that out as far as the providers are
Yeah,
going.
this plan was born in Hernando County, so it has been open there for 11 years. And we do have a new president, Matt Romeo, who has been in the Medicare Advantage field for a long time, and also the provider IPA, MSO field for such a long time. He's really going to bring new ideas and new energy to this company, which is already doing amazing. Again, I'm going to my second year. Never felt at home like I do here. And it's a company that really makes a lot of sense, common sense.
We love that. We love that. And thank you very much for your time this morning. When you have more trainings, or if you want to get together and create one for the HPM team, we're happy to do so. Again, I know that this was very high level, but we wanted to introduce a lot of our new agents that are on this call that may not have known about Ultimate because they're just not seeing it on our enrollment platform. But now that we know that it's out there, let's get together and really make sure that our seniors are on the best plan and looking at the benefits that Ultimate's bringing to the table. I mean, you might be missing the boat here. So thank you, Ricardo. Thank you, Lexi, for your time this morning. We really appreciate it.
Thank you, Justin. Thank you, everyone. Have an amazing day. Please call me if you need anything. Rosie already sent me an email.
Oh, yeah.
Thank you, guys.
You're very welcome. All right, everyone. That's it for today's call. We'll see you next week. Same time, same station. In the meantime, wrap up your OEP, call all those leads, and make sure that all of your clients are taken care of in a 5-star manner. We really appreciate all that you do. Again, have a great week. You know how to reach us, 844-696-3975. Take care.
Take care, everyone.